Welcome back to another episode of HealthCap Weekly Wrap. This week, we're digging into a major Medicaid financing change from CMS, a new report on Medicare improper payments covered by Fierce Healthcare, an important survey memo that communities really need to understand, and some practical quality improvement resources from the South Central QIN-QIO. So yeah, this is one of those weeks where policy and real-life operations collide.
It really is. And honestly, every single one of these stories touches senior care communities in a direct way.
All right, let's start big picture. According to a press release from the Centers for Medicare and Medicaid Services, CMS says it's shutting down what it called a massive Medicaid tax loophole, saying it will save billions of dollars and restore the federal-state partnership.
Yeah, and that phrase alone probably made some operators sit up a little straighter.
Right? Anytime we hear billions and Medicaid in the same sentence, we're listening. So here's what's happening. Medicaid is jointly funded by states and the federal government. Some states have used certain provider tax arrangements, especially involving Medicaid managed care organizations, in ways that allowed them to draw down more federal matching funds. CMS is saying some of those arrangements weren't aligned with the intent of federal rules.
So this isn't about communities doing something wrong?
No, not at all. This is about how states structure their financing. CMS is tightening oversight and saying, essentially, we're going to make sure the funding partnership works the way it was designed to.
Okay, so let's bring this home. Why should a senior care executive director care?
Because Medicaid is a primary payer source for many skilled nursing residents. If states have to adjust how they finance their Medicaid programs, that can influence rate discussions, supplemental payments, and managed care structures down the road.
So even if nothing changes tomorrow, the environment could shift.
Exactly, and margins are already thin in many communities. So the takeaway here is awareness. Stay connected to your state association. Watch how your state Medicaid agency responds. These federal changes often ripple outward.
And I think there's a mindset piece too.
Oh?
Yeah, when CMS emphasizes financial integrity at the federal level, it usually signals tighter scrutiny everywhere else.
That's a great point, which actually leads us into our second story.
According to Fierce Healthcare, CMS estimates Medicare made $28.8 billion in improper payments in fiscal year 2025.
Yeah, $28.8 billion. That's a big number.
It is. Now, Fierce Healthcare reported that the improper payment rate for traditional Medicare was 6.55% in fiscal year 2025. And importantly, improper payments don't automatically mean fraud.
Right, that's key.
A lot of improper payments come down to documentation gaps, missing physician signatures, incomplete medical records, claims that don't fully support the level of care billed.
And that's where senior care communities need to lean in.
Absolutely. If you're providing skilled services under Medicare Part A or billing Part B therapies, documentation has to clearly reflect the resident's condition and the care delivered.
I feel like we say this every week, but if it isn't documented, it didn't happen.
Exactly. And here's the thing. Even though 6.55% is below the statutory threshold, CMS highlighting documentation vulnerabilities means auditors are paying attention.
So what should communities do?
First, audit internally. Look at your MDS accuracy. Review therapy documentation. Make sure physician certifications are complete and timely. Second, educate your team. Documentation isn't just the responsibility of billing, it's interdisciplinary.
And I'd add this. Documentation tells the story of the resident.
Yes. When nurses and therapists understand that their notes justify the care plan and demonstrate clinical complexity, it becomes more meaningful. It's not just paperwork, it's representation of the care you're providing.
And when documentation is strong, it supports both reimbursement and survey outcomes.
Which brings us right into our third story.
CMS released memo QSO 2603NH on January 30th, 2026. This memo updates chapters 5 and 7 of the State Operations Manual for Nursing Homes.
Yeah, this one is very operational.
According to the CMS memo, the revisions include updates to survey procedures, guidance around immediate jeopardy determinations, civil money penalties, off-site revisit processes, and nurse staffing waiver guidance.
That's a lot in one memo.
It is. And even though some of this builds on existing frameworks, the clarifications matter. For example, clearer examples of what constitutes immediate jeopardy help both surveyors and providers understand thresholds.
And immediate jeopardy findings can carry serious consequences.
Exactly. They can trigger significant enforcement actions, including civil money penalties and directed plans of correction.
So, what's the takeaway for leaders?
Don't ignore these memos, review summaries. Talk through the changes with your director of nursing. Incorporate the updates into your QIN-QIO discussions.
And maybe even run a mock survey with these updates in mind.
Yes, preparation is everything. Communities that routinely evaluate their own processes are better positioned during actual surveys.
And I think this ties back to culture again.
It does. If staff feel comfortable reporting concerns internally, leadership can address issues before they escalate. That proactive approach makes a huge difference.
All right, let's close with something supportive and practical.
On the South Central QIN-QIO website, there's a nursing home and skilled nursing facilities resources page filled with tools and educational materials.
Yeah, and even if some of these resources have been available for a little while, they're still extremely relevant.
Quality Innovation Network, quality improvement organizations are funded by CMS to help providers improve care quality. The South Central QIN-QIO offers resources on infection prevention, reducing avoidable hospitalizations, improving care transitions, and supporting workforce development.
So, this is the how.
Exactly. After talking about federal financing changes, improper payments, and survey enforcement, this is where we shift to improvement. These resources help communities strengthen systems before problems arise,
And many of these tools are available at no cost.
which is important. With tight budgets, leveraging federally supported educational materials is a smart move.
I also love that these resources can plug directly into QIN-QIO.
Yes, whether you're working on reducing hospital readmissions or improving infection prevention practices, these toolkits provide structure and guidance.
So if you haven't connected with your QIN-QIO, maybe this is your reminder.
Reach out, attend a webinar, download a toolkit, share it with your leadership team. Quality improvement isn't separate from compliance. It supports it.
As we zoom out, there's a common thread across all four stories.
Accountability.
Financial accountability at the Medicaid level, payment accuracy in Medicare, regulatory clarity in survey enforcement, and quality accountability through QIN-QIO support.
And for senior care professionals, that means staying informed, strengthening documentation, investing in education, and leading proactively.
At the end of the day, all of this policy and oversight exists because we care for the resident. Strong systems, accurate documentation, and thoughtful leadership help us continue that mission.
Well said.
Thank you for tuning in to another episode of HealthCap Weekly Wrap. We know you're doing challenging, meaningful work every day in senior care communities, and we're grateful you're here with us.
For more details on these stories, you can find them in the weekly roundup on Angie's blog at healthcapusa.com/Angie's blog. We'll see you next week.